There's a new study that found weight loss surgery is becoming more common among children and teens to treat obesity. According to data published in the Journal Pediatrics, the number of weight loss surgeries among youth had been rising since 2016. So between 2020 and 2021, weight loss surgeries among children spiked 19%. Just in that year, it's estimated 1 in 5 children right now in the U.S. are living with obesity. It's a big concern. We're joined now by Dr. Monica Gahndi. She is a professor of medicine and associate division chief of the Division of HIV, Infectious Diseases and Global Medicine at the University of California, San Francisco. We'll get to the why in a moment as to so many kids challenged with obesity right now, but going to surgery as an option so young as their bodies are growing, what's the concern here?
You know, the concern is that the growth plates haven't yet fused. So children can grow at different rates. Boys grow later. Girls can have their growth happen earlier. And before you've completely grown, you really want that continued nutrition. And the problem with weight loss surgery, what does it do? It actually cuts off your stomach. So it's a smaller stomach. You have to eat smaller meals. By definition, you have to eat smaller meals. So you're going to take in less, and you can't really adjudicate how you need to respond to your growth needs because you absolutely have to have a certain meal and size of meals each day.
But are there doctors who are agreeing with families that this is the right option for certain children, certain teens?
Yes, I mean, clearly this has really increased especially from 2020 to 2021, like you said, a 19% increase in what's called bariatric surgery, which is the stomach surgery. So clearly the doctors are agreeing. The question is, do we rush too much, to go to kind of surgical or medical solutions as opposed to nutrition and exercise, which is like really tantamount for young people is exercise.
Right. And so that's the why, right? Why are young kids facing some of these health challenges so early on? I mean, what has changed in your medical practice as you talk to patients, as you talk to people? What more do we need to be doing to prevent obesity rather than treat it once it happens?
Really, it's around sedentary lifestyle. And, obviously during the pandemic, what happened was a lot of schools were closed. They were closed for probably too long in many states. And because of that, children were inside. They weren't playing as much. They weren't like with each other. And that we've watched this during the pandemic. We've seen increases in overweight and obese children just in a short period of time of being locked out of school, not having a routine, not having school sports. So it's really going back to all of that school sports and then exercising, routinely incorporating exercise. We're always on screens. Children are not out like they used to be. And it's really about exercise and then nutrition, which is around sugary snacks and what we feed people in school and reducing the amount of sugar. So it's old-fashioned, but it's nutrition and exercise.
Yeah, and surgery really should be a last option
Yes.
for people as our kids are growing and growing. All right, I
Yes.
want to get your thoughts on another health topic this morning. COVID and RSV cases have been dropping in the U.S. That's good, but there's this lesser-known virus that saw a surge in infections at the same time, according to the CDC. There's a percent of tests from hMPV. It went up nearly 20% for antigen tests, 11% for the PCR test in March. During the pandemic, the percent of positive tests for the virus reached higher than 7.7%. I just threw out a lot of percentages. I don't know what any of that means. What is hMPV and why should we be worried about it?
So it stands for human metapneumovirus. So the way to think about this particular virus, it was discovered in 2001 in the Netherlands, and it's a respiratory virus. All of these are respiratory viruses, and they're all RNA viruses. That just means the genetic material they have. And we used to see human metapneumovirus all the time. It's just that COVID SARS-CoV-2 really dominated the news cycle for the last 3 years. But human metapneumovirus goes up and down. So does RSV go up and down. So does rhinovirus. So does adenovirus, other coronaviruses. These para-influenza virus, influenza virus, these are the host of respiratory pathogens that we live with. And what happened is SARS-CoV-2 interfered. COVID interfered with all these other viruses. So when we would do antigen testing, it was the predominant virus for so long. And then now that we have so much immunity in the population, the global health emergency for COVID is over. And so is the public health emergency in the US. Doesn't mean it's gone, but it means it's kind of circulating along with the other respiratory pathogens. So as it went down, then these other viruses could come up. And we're now used to doing antigen screening. So we could identify that this last spring, there was a lot of human metapneumovirus. It causes the common cold. It causes exactly what you're showing here, which is sneezing and coughing and headaches and muscle aches and can be mild fevers. But in older people, they can make them more sick.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.